Hello everyone and welcome to my channel. So in continuation with the series that we have already started on the new drug, today we are going to discuss a very interesting drug, and that drug is known as Lecanemab. So basically we will be covering our topic under the following points. So let us take one heading at a time. First, a few salient points about this new drug. The drug is sold as the brand name of Lecanemab. It was approved by the US-FDA on 1st January 2023, and it was approved under the accelerated approval pathway. Now, accelerated approval pathway basically means that US FDA often approves a drug, or rather can approve a drug in certain conditions in which there is an unmet need of the drugs, or rather in those cases where a surrogate endpoint suggests that the drug can have a clinical benefit in the future. So this drug has been approved under the accelerated approval pathway. So now what is the mechanism of action? So lecanemab, it is basically a humanized immunoglobulin gamma 1, or rather a IgG1 monoclonal antibody. And this drug acts against the aggregation of both the soluble as well as the insoluble forms of the amyloid beta protein. Now we all know that deposition of the amyloid beta protein and the formation of the neurofibrillary tangles, they are the hallmark of Alzheimer's disease. So this drug basically reduces the deposition of the amyloid beta plaques. And how does it do so? It does so by acting against this aggregation of both the soluble as well as the insoluble forms of amyloid beta protein. Now, as we have already discussed, this is basically indicated for the treatment of patients of Alzheimer's disease, and this drug is initiated in patients who have got a mild cognitive impairment, or in patients who are at the mild dementia stage of the disease. Now the efficacy of the drug beyond this stage has not yet been established. So there are certain instructions that we need to keep in mind before we are starting the dose. The first thing is that we must confirm the presence of the amyloid beta pathology prior to initiating the treatment. So one of the ways to do that is by, one of the ways to quantify this amyloid beta plaque deposition will be by the PET scan. And also we need to obtain a recent, that is within 1 year MRI of the patient, a brain MRI of the patient prior to initiating the treatment. And again we need to obtain an MRI prior to the 5th, 7th as well as the 14th infusion. Now we do both these points basically to keep a check on the deposition of ARIA, that is amyloid related imaging abnormalities. So to keep a check on the development of ARIA, we need to do both these points. So now what is the dosage and administration? The drug is basically recommended at a dose of 10 mg per kg, and this calculated dose is diluted in 250 ml of 0.9% normal saline, and then it is given as an intravenous infusion form with the time taken for the infusion is approximately 1 hour. And how frequently we need to give it? The dosing frequency is basically once every 2 weeks. So as what is the dosage form and strength? So as we have already discussed, it is given is an intravenous infusion form. So it is available as an injection form. There are basically two strengths. Both of them are available as a single dose vial, and one of the strength is 500 mg is present per 5 ml, which means 100 mg per ml, or in a vial of 200 mg per 2 ml, which is also 100 mg per ml. So in both the single dose vials in the two different strengths it is available. So now what is the adverse drug reaction? As I've already told you, the most common adverse drug reaction is the development of amyloid related imaging abnormalities or ARIA. Now this ARIA can be of two types. One is ARIA E. E stands for edema. That is, we can see brain edema on MRI. And another is there can be H, or H stands for the deposition of hemosiderin. So in most of the cases it has been seen that ARIA E and ARIA H, they occur together. Another is that there can be development of infusion related reactions, and the patient can have fever or other flu like symptoms. Also they can have nausea and vomiting. Some of the other less commonly occurring adverse drug reactions are headache, cough and diarrhea. So some points on the pharmacokinetics. The time taken to reach the steady state concentration is approximately 6 weeks. The volume of distribution is 3.22 liters. Now we have also got a detailed video on volume of distribution. Please feel free to check it out. The link will be given in the description box as well as on the I button above. This drug is also degraded by the proteolytic enzymes, and the half-life of this drug varies from 5 to 7 days. So that's it for today, guys. If you like the video, then please give it a thumbs up. Do share it and let us know down in the comments below what other topic you would like us to discuss. Also, please subscribe to my channel and don't forget to press the bell icon so that you don't miss out on any upcoming videos. So until next time, goodbye.